In this video, I'm going to show the thoracic vessels in the cat, the arteries and the veins. So here's the heart located in the thorax. This vessel is the pulmonary trunk, which gives rise to two arteries, left and right pulmonary artery. Then this is the arch of aorta, which in the cat bifurcates into the brachiocephalic trunk and the left subclavian. So here's the brachiocephalic trunk and the left subclavian. I also want to show here the superior vena cava coming into the right atrium. Its tributaries are the right brachiocephalic vein and the left brachiocephalic vein. And the brachiocephalic veins on each side also have tributaries. So these tributaries are coming into the brachiocephalic vein. So this is, for example, the subclavian vein, and here's the external jugular vein. So subclavian and external jugular on either side coming in to make the brachiocephalic vein on each side. Now, in the cat, the brachiocephalic trunk trifurcates into the right subclavian artery, the right common carotid artery, and the left common carotid artery. So the difference between the human and the cat is that the left common carotid artery in the human is branching off of the arch of aorta. And then here, as I mentioned before, this is the left subclavian artery. The subclavian branches, the major branches that we want you all to look at, are three. The first one is this small artery called the vertebral artery. The second is this vessel, the thyrocervical artery. And the third one here is the internal thoracic or internal mammary artery. Now, a couple of things I want to mention is that the subclavian continues in the shoulder area and very close to the brachial plexus, right in the midst of brachial plexus, the subclavian changes its name to the axillary artery. It's the axillary artery. The vein that I want to make sure that you guys look at in this dissection, this vein is the azygous, A-Z-Y-G-O-U-S, azygous vein that drains the posterior intercostal veins from the right side. Azygous vein, only seen on one side. This is also a tributary of the superior vena cava. In this video, I want to show you a few appendicular vessels. So you should be familiar with the femoral triangle. This is the femoral artery, and in the human, looks very similar. In the human, actually, the external iliac gives rise to the femoral artery just past the inguinal ligament. This is the femoral vein, and then it continues, the femoral artery continues as, this is not very red or very big, but this is the saphenous artery running with the saphenous nerve. Some of these veins and arteries, when they're small, then it's really hard to inject the latex into these vessels. If you look in the posterior surface of this leg, you might be able to see this is probably a branch of the posterior tibial artery. Like I said, it's sometimes difficult to find these arteries. This looks like maybe a artery running with the nerve. And then the anterior tibial artery is in the anterior compartment, and you can see it clearly here, anterior tibial artery.